Thank you, James, and thank you, everyone, for participating here. So yes, we would first to say about some Nari Maitree first. Then we will go to what we do under the first track two care under the two care here. So Nari Maitree is a women-led organization in Bangladesh established in 1983, and as we have our mission is to empower and establish the disadvantaged population, particularly the key vulnerable population, including women, children, adolescent, and marginalized urban communities. So in track, we have a great partnership with the STOP Partnership Global Fund. We are working in Bangladesh since 30 years, especially particularly on the TB. So we have a great experience to work with the like Global Fund, and also we have implemented project with the STOP Partnership. And now we are very good proud partner to the TB Alliance to establish the people in Bangladesh. And now, if we come to the plan of our what we want to do about our under FTA of fast track the cure, specifically particularly in Bangladesh. So we particularly select two areas of the Bangladesh like Dhaka and Narayanganj, which is the most urban centers facing significant GRTB burden. Specifically, these have some high density population and also some the great slum population in here. So under this intervention of this fast track the cure, we have some intervention package that we specifically designed directly for address the critical barriers that for the TRTB detection, treatment, and also the patient insurance care. So these are the just interventions that we will doing the capacity building. Under the capacity building, we will train 30 people ambassador, including the community health workers, TB survivors, and dot providers. They will act as the ambassador for this people system for us. And we will also under the knowledge generation and behavior change, we will conduct a baseline and inline knowledge, attitude, and practice assessment. By that, we can get the information from our specifically from the baseline, and also we will develop a disseminate and ICBCC materials, which will think that this better materials will tailor specifically to address the stigma and also the misinformation and low treatment seeking behavior. So as a there are some still some facing the problem of DITB patients in Bangladesh, and we will then that's why for we will establish some peer support groups and digital support movement, digital feedback system. Specifically, we will can use the One Impact apps that we have already tried to some pilot basis implement in Bangladesh. So that's One Impact apps can help us to mapping the services and report the success barriers. So we'll talk with more about how we can involve the One Impact app in this feature also. And specifically, it is very important to work with the NTP. We have already worked with the NTP persons, specifically National Tuberculosis Program, that they will going to the updated the fourth edition of the national guideline and operational manual. So we will try to include to the people system into the new guideline. So I hope it could be strengthening and referral linkage and also the health system coordination. Next slide, please. Okay, thank you. Specifically, that's why I think the why this work matters particularly for the TB community in Bangladesh. As you know, some of you that the Bangladesh is one of the 30 high TB burden countries, and specifically the seventh rank for the TB patients in the all over the world. All over the world. In 2019, 3,300 estimated MDA TB patient then found, and only 42.4% percent was diagnosed. So that's 1,200 started the second line treatment. So it takes a long time, specifically for the patients who are the MDA TB patients, to make them the cure. But we will try to talk with the NTP and try to update the PMDT guidelines that will promote the community-based care and early diagnostics. So, but still there are some barriers still happening, like gaps in screening the children and high-risk groups, like key vulnerable populations. And also there are some very limited training in here, like for the people regiment, specifically for the dot providers, and all around the fear, specifically the slum area, and also in some high society area, the stigma and fear around when the patients attacked by the DRTB, they think that this a very is not there is not any curement for here. But this newer treatment, like people could be to help them to reduce their fear and stigma. And also there are some low treatment seeking behavior, and specifically the urban slum population. And also the referral linkage we need to work in here. There is some weak referral linkage, and also limited participation of the community. So as the community-led monitoring, we are very much engagedly working with the STP partnership. So we will try our use our experience for increase the participation of the community voice, how we can planning. So though this is initially a 1 month program, but the outcome as this is the award, initially that was the awareness, but we are going to extend the program. So as the outcome, we think that enhance the community awareness and also the early case detection that could be increase the local entrepreneurship, and also behavior change. That is very important. So behavior change communication. So if you change, introduce the BCC and IC materials that can be used to reduce the stigma, dispel misinformation, and empower patients and families to seek earlier care. And also, if when we make some peer groups, that peer support groups and the survivor networks will provide counseling, emotional support, and shared experience to improve the enhance to the deeper treatment. And when we will working with the community, so our community feedback mechanism like digital tools, One Impact, that will enable our real-time monitoring of service barriers, patient experience, and referral gaps. We can discuss in there and get the feedback from them, how we can assist our community, and also make our healthcare system stronger by making this thing, including in the national policies. So I think Nari Maitree's engagement, specifically particularly in the fast track the cure, is designated to convert community awareness into the tangible access of the DRTB services. So we hope Nari Maitreee can contribute in particularly in Bangladesh significantly uh, to advance Bangladeshi national NTP goal, and that will ensuring that the most vulnerable population are not left behind. So thank you. That's from our end.